Given the circumstances we're living under, it's understandable if we have a lot on our minds, and the health of our minds is important.
It's a big thing. May is Stroke Awareness Month, and an increase in COVID-19 related strokes has put added emphasis on the need to look for signs.
WJZ is live. Pat Warren has more on the warnings. Pat.
Well, unfortunately, there is growing evidence that COVID-19 also increases the risk for having strokes. And not only that, but another effect of this disease is that people who are experiencing symptoms are afraid to go to the hospital. Now more than possibly ever is a time to be alert to the risk of debilitating and often fatal strokes. LifeBridge Chief of Neurology, Adrian Goldschmidt, cautions against taking it lightly.
It is the single leading cause of adult disability, about 800,000 new strokes a year and about 150,000 deaths.
And during this pandemic, with the number of people who go to the hospital with symptoms of stroke going down, there is fear that many more may be having strokes at home as a complication of COVID.
Or me, while I'm having these symptoms, I don't want to go to the hospital because I'm afraid of getting COVID. I'm afraid that I'm not going to have the ability to see my family when I'm having these health issues. And that's direct impact, and that's a problem because, like we say, time is brain.
COVID is primarily a respiratory disease, which can make patients vulnerable to brain injury for lack of oxygen, as well as blood clots.
Because COVID can affect the clotting system, patients, including some young patients, are developing stroke, and these are patients that have few, if any, risk factors.
The key is to act fast.
FAST is a 10 or 15-second screening tool that will pick up most but not all stroke symptoms.
Remember face. Ask the person to smile to see if one side of the face is drooping. Arms, have them raise both arms to see if one drifts lower than the other. Speech, ask them to repeat a simple phrase to listen for slurring. And time, don't waste it.
I want to call 911 because there are things that the first responders can do to help start the recovery process right in the ambulance.
For more information on the Brain Injury Association, go to WJZ.com. I'm Pat Warren reporting live for WJZ.